Hello everybody, good evening. Welcome to Nursing channel. Today we will speak about mechanical ventilator and nursing intervention and VAP bundle for the patient. We speak in the last 3 videos about parameters of mechanical ventilators, modes of mechanical ventilators and alarm. Now we will speak about VAP bundle and nursing intervention. Let's start. At first we will speak about nursing intervention. This is the common nursing intervention which we will do with the patient during mechanical ventilation. The first thing, monitor vital signs. You must monitor your patient vital signs. Your patient must connect it all the time by cardiac monitor to know heart rate, respiratory rate, auto saturation, everything for the patient. The second thing is hand hygiene. You must do hand hygiene before and after dealing with the patient or handling the patient, do any procedure. So you do hand hygiene before and after any procedure with the patient. Third thing, ensure intratracheal tube and tracheostomy tube plaster is secured. You must ensure there is some hospital put plaster and fix it intratracheal tube by plaster and another fixed by gauze. So at this time you must ensure this plaster is good, not tight, not very tight or very loose. So at this time you must ensure. The second thing, after that, ventilator setting. You must know your setting or mode the patient on during mechanical ventilation. Okay. After that, suction as needed. Don't do suction all the time. Suction only as needed and not exceed 10 seconds. 10 seconds for suction. We know we have 2 types of suction: open suction and closed suction. We said open suction, this is from the center of suction, then you connect by tube and disconnect ventilator, suction for the patient. This type. The second type is closed suction. This by T connection between ventilator and intratracheal tube. We put this one. It's connected all the time. So if you need suction, so you insert the tube only without disconnection for the mechanical ventilator. Okay. If this closed suction is available, use this one. If not available, you will use the open suction. After that, if the patient have tracheostomy tube, you must do dressing for tracheostomy tube. Sometimes there is too much secretion on the dressing under tracheostomy tube, so you need to change this dressing. Okay. After that, evaluate progress of the patient on mechanical ventilator. You must evaluate the progress of your patient. The patient take his breath good or no? What is the progress of the patient? Okay. After that, we will speak about VAP bundle. What is the VAP bundle? V, this is ventilator. A, associated. B, pneumonia. Ventilator associated pneumonia. From the name, this pneumonia associated during mechanical ventilation. What is the difference between this one and hospital-acquired pneumonia? In hospital-acquired pneumonia, the patient not on mechanical ventilator. But at this one, the patient must be on mechanical ventilator. Okay? VAP acquired to the patient after 48 hours from ventilation and intubation. So we know this one during intubation. This happened for the patient after 48 hours, or if there is VAP with the patient, it will appear after 48 hours from intubate the patient. Okay. What is the sign and symptoms which appear on this if the patient have VAP? The first thing is cough. If the patient have too much cough, if not sedated, he will cough. So when he cough, he will have high pressure alarm. The ventilator all the time give high pressure alarm because there is resistance between the pressure from ventilator and the patient because there is cough. So the ventilator at this time will give high pressure. Okay. After that, there is fever. The patient will have fever. At time of fever, there is increase in heart rate and respiratory rate for the patient. Okay. The patient will have chills and shortness of breath. Shortness of breath because there is inflammation in the lung. So the patient can't take his breath good. So most of the time the patient have shortness of breath. Okay. If you draw ABG for the patient, so you will find increase in CO2 of the patient and decrease in O2 because the patient not breathe good or not take his pressure or his ventilation good. So the patient here will have increased CO2 and decrease in O2. Okay. The patient will have cyanosis because decrease of O2. So the patient will have cyanosis. Okay. Diaphoresis, you will find the patient all the time wet. There is too much diaphoresis. So sometimes you will find the bed is wet. So from diaphoresis, sputum will increase and secretion will increase because there is pneumonia and there is secretion accumulation in the lung. So you will find too much secretion with the patient. Okay. How we will diagnose VAP? VAP will diagnose by too much things. The first thing is labs. We'll do for the patient CBC, CRB, the inflammation markers. You will find white count is high, CRB is high for this patient. You will do for the patient cultures, blood culture, sputum culture, urine culture. Okay. For this one, you can do chest X-ray or CT chest. Mostly diagnosed by chest X-ray. In chest X-ray, it will appear pneumonia. Okay. How we will treat VAB if the patient have VAB? The first thing, we will do elevation for the head, elevation of head of the bed from 30 to 40 degree, unless there is contraindication. If any contraindication for with the patient, like spinal cord injury or anything happen in spinal cord, so at this time contraindicated to elevate your bed. Unless this one is found, so you can't elevate the head of the bed. Okay. After that, you must consider sedation. Give sedation to the patient to let your patient relax, and consider weaning from ventilator and weaning from sedation. You must stop your sedation as per doctor order every day to check the progress of the patient, to check the conscious level of the patient. After that, oral care. You must do oral care to the patient as per policy, as the policy of your hospital. Some hospital use chlorhexidine, the one green, so they clean the mouth by this one. Some hospital, another hospital use an instrument and gauze and normal saline and wash the mouth from inside and clean the mouth. Okay. After that, prevent DVT. How to prevent DVT? There is machine like air mattress we put in the leg of the patient, the both leg of the patient. It do massage to the calf muscles of the patient. So this machine can prevent or mostly prevent DVT. Second thing, medication. You can give medication to the patient like heparin, like Kilexan, as per doctor order for the patient. Okay. After that, prevent stress ulcer like peptic ulcer. So at this time, you can give to the patient proton pump inhibitor like omeprazole, pantoprazole, something like this, if infusion, or give once per day, twice per day, as per doctor order. Okay. After that, prevent pressure sore or bead sore. You must do positioning for your patient. QU 2 hours, after every 2 hours, so you must do positioning for your patient, right, left, back, like this. Okay, to prevent bed sore. Suction as needed, as we said, suction as needed. After that, antibiotic as per doctor order. Antibiotics is considered. First thing, doctor start antibiotic empirical. After that, your doctor, after he have result for blood culture or sputum culture, there is antibiotic in this one, so he will put the good antibiotic or the antibiotic written in the culture to the patient. Okay, so we know the treatment of the bundle. Now we finish everything in a mechanical ventilator. If you found this video is good, please don't forget to subscribe and share. Thank you.